Hello everyone, welcome to the Nursing Virus YouTube channel. This is me Logunathan. This video regarding the image based question for the various nursing officer grade exams or the staff nurse grade examinations, which were mainly focused on the clinical based questions. Most of the questions I have discussed on this video were mainly related with the clinical images and instruments, which is mainly important for upcoming examinations. And even I have already uploaded many videos related with the image based question and that solved question paper of the nursing officer examination which were asked in the previous examinations, and you can check the link for the video description or in the playlist for the videos.
Do subscribe on Nursing Virus channel if you not yet done. And don't forget to click the bell icon and like button so you don't miss any videos.
Let's go with the today discussion. Question number 16. What is the condition according to the given image? The options are placenta previa, velamentous cord insertion, placenta accelerator, and normal placenta. The correct option is velamentous cord insertion. So here the rationale. So here on that left side you can see the normal umbilical cord insertion. So that is which the umbilical cord were coming from the fetus umbilicus and directly attached to the midway of the placenta. So when it is getting connected from the umbilicus cord to the placenta, that is called as normal placenta. But whereas on the given image you can see something were getting different from the umbilical cord and connecting part of the placenta. So here, when the fetus umbilical cord abnormally inserted into the edge of the placenta along with the chorioamniotic membrane. So here you can see the umbilical cord were attached in that midway of the amniotic and chorionic membrane before connecting to the placenta. So this is the placental area. And these kind of blood vessels, that mean whichever coming from the fetus area, these blood vessels were unprotected. That is exposed blood vessels. That is called as exposed blood vessels. So due to this, pregnancy will used to get much complicated, and this condition were mainly called as velamentous cord insertion. So here you can see on that real clinical images of the placenta. Question number 17. Identify the sign shown in the photograph. Options are Troisius sign, Homan sign, Kerning sign, and Rosing sign. The correct option is Troisius sign, or it's otherwise known as carpopetal spasm. This Troisius sign or the carpopetal spasm, when it used to happen mean, so this is the main sign of latent tetancy. This is the medical sign observed in the patient with a low level of calcium. From 1 to 4% of normal patient will test positive for the Troisius sign for the latent tetany. So mainly here you can see the carpopetal spasm, you can see on the given image. So other option, the Homan sign will used to happen in the DVT, and for that Kerning sign will used to happen in the case of meningitis, and Rosing signs can be observed in the case of appendicitis. Question number 18. Identify the following instrument in the given image. Options are otoscope, tonometer, ophthalmoscope, and knee hammer. The correct option is otoscope. So this is the instrument where otherwise called as ariscope, is the medical device which is used to look into the ears. An otoscope potentially give a view of the ear canal and the tympanic membrane or the eardrum. So here on that second image you can see how the clinician will used to have the look on the patient ear. Question number 19. Identify the condition from the given picture. The options are scoliosis, kyphosis, lordosis, and none of the above. And the correct option is lordosis. Here we'll see the rationale. So how the normal spine will used to look, you can see the straight away from the thoracic and lumbar and coccyx, it will continue. And whereas on the lordosis patient, an exaggerated lumbar curve you can see mainly on the lumbar vertebrae. So this is the curving inward of the lower back, and lordosis mainly cause an unusual large inward arch on the lower back and just above the buttocks area. So this condition mainly will use to cause much lower back pain. And the question number 20. The skin condition shown in the picture is known as warts, blister, ecchymosis and psoriasis. The correct option is blister. So the blister is a bubble of fluid under the skin. So the clear watery liquid inside the blister is known as mainly serum. The blister is too small, that is called as vesicles. So those larger than the half an inch are called as bullae. 21. What is the name of the instrument on the given image? Ovum forceps, Kocher's homeostatic forceps, Alice tissue forceps, multiple toothed valsalum. So the correct option is multiple toothed valsalum. So here the main uses of the multiple toothed valsalums are used to catch and hold the anterior lip of the cervix in case of dilatation and evacuation operation and suction evacuation. And main contraindication, you cannot use this instrument during the pregnancy to avoid the cervical bleeding and laceration. Hence the instrument having sharp teeth, we cannot use this one. How we can identify? Mainly this instrument will use to have the gentle curve. It is a slightly curved one, and the tip of the blade, one side will use to have the 3 teeth and another side will use to have the 4 teeth. And the other type of valsalum forceps are single toothed, double toothed or multiple toothed. And 22. Identify the type of delivery shown in the picture. The options are vacuum assisted delivery, forceps delivery, normal delivery and C-section. It is very easy to identify. The correct option is vacuum assisted delivery. Here on the image itself you can identify the vacuum device or vacuum extractor can be used to pull out the baby. Mainly when we used to use this vacuum extractor there are the 2 type of indication. One is maternal and another one fetal. For the maternal side, the maternal exhaustion or when the mother were not cooperating much or prolonged second stage of labor. For the fetal indication side, the fetal distress in the second stage of period. How it can be identified mainly there will be changes in the fetal heart rate. At the time, immediately we will go with the pulling of the baby through either vacuum extractor or even sometime they used to go with the forceps delivery. 23. Identify the gas cylinder shown in the image. Nitrous oxide, oxygen cylinder, carbon dioxide and helium cylinder. The correct option is oxygen cylinder. Here the rationale. Here I given the different color codings for the various gases. The first one for the oxygen, they used to have the white shoulder and black body. On the images also you can see the white shoulder and the remaining part of the cylinder in the black color. And for the nitrous oxide, it will be in the light blue, and the nitrogen completely black, even that head also will be in the black color. And for the carbon dioxide will be in the gray color, and for the helium gas will be in the brown color cylinder. And 24. Identify the instrument given in the below image. USG machine, automated external defibrillator, portable mechanical ventilator and pulse oximeter. The correct option is automated external defibrillator. This kind of device is an portable electronic device that is automatically diagnose the life-threatening cardiac arrhythmias of ventricular fibrillation, that is a VF, and pulseless ventricular tachycardia. These are the 2 signs for giving the or using the defibrillator, these two things automatically will be identified by this equipment, and automatically it will fix the electrical current and will give the defibrillation. So here you can see the paddles which you can fix in the apex of the heart and another one in the side of the heart. And 25th, identify the material in the given image. Copper T Cu380A, Nova T, Copper T Cu200A, multi-load Cu375. So here the correct option is Copper T Cu380A. So it is an T-shaped device with a polyethylene frame holding 380 mm square of exposed surface area of the copper. So here that everything in the copper material. So that IUD frame contains barium sulfate, those making that radio opaque, and this one can be used up to 10 years, or even sometime it can be used up to 12 years also. And 26, identify the given instrument name. Options are uterine curette, flushing curette, Alice tissue forceps, ovum forceps. The correct option is uterine curette. So that is mainly single side uterine curette. Here the explanation. The main uses, so mainly used for scrubbing that endometrial cavity to obtain the samples of histopathology, and another one used in the operation of dilation and curettage or for incomplete abortion for collecting that remaining products, and third one used in the dilatation and evacuation operation. The curettage is done by blunt curetting as that uterine wall is so soft. We won't use the sharp side. Here how you can identify the angle of that. So here the angle of that curette will be 15 degrees angled one. So this is the mainly single ended. Even we'll have the double ended uterine curette also. So in that kind of cases you can see in the opposite also there will be an curette. So that is that either soft or blended one. 27. What is the name of that position shown in the picture? The options are lithotomy position, reverse Trendelenburg position, and Trendelenburg position, and dorsal recommend position. The correct option is Trendelenburg position. So here this position mainly will make the person, the head end will be down and the lower egg extremities will be in the upside. So this position mainly when will use in the time of pelvic and gynecology surgeries and in case of hypotension patient. So when you are keeping this kind of position, the blood pressure will used to get high. 28. Which fetal life types shown in the picture? Breech presentation, transverse presentation, and vertex presentation, and oblique presentation. So here the correct option is transverse presentation. For the rationale, the fetus on the given image were lying on the pelvis with the transverse position. Normal position, how it will be that is called as vertex presentation. The fetal head will be fixed in the pelvis area and the breech will be in the upright position. So that is called as vertex presentation. That is a normal one. And 29th, assess and calculate the immediate APGAR score of the newborn baby from the given findings. The options are 8, 6, 7 and 10. Here they given the scoring pattern also. For the respiratory effort, good cry, the heart rate over 100 beats per minute, and muscle tone, activity body movement, grimace, slight, and appearance, body pink and extremities blue. The correct option is 8. Here we'll see the explanation. So this is the normal APGAR score assessment and that scoring pattern also. So this was the scoring, and here you can see the interpretation of the result. So here we'll see the respiratory effort, the good cry. That means the baby who are having the good cry, that is the score of 2, and the heart rate over that 100 beats per minute. So here in the chart you can look, that is a 2 score you can give. And muscle tone, active body movement. So in that kind of cases, again we need to go with a 2 score. And for the grimace, that is kind of an reflex. That is the child is having only the slight grimacing reflex. So we'll go with the score 1. Suppose if it is completely absent, mean we'll go with a score of 0. But here they're given slight response. And the next one, the appearance, that is a body pink and extremities become blue. So that means the score of 1 will go. So the total if you are making, that is around 8. So here we can make the interpretation. Between the 7 to 10 is normal, and 4 to 6 is moderately depressed, and 0 to 3 need immediate resuscitation. Here the baby is getting only 8, so that is coming under the normal. So we no need to have much bothering. So after 5 minutes or after 15 minutes, you can take another APGAR score and we can find the result. And question number 13. The line drawn from the umbilicus to the right anterior superior iliac spine and 1/3 of the distance lateral line is called as. So the answer is directly I am giving, that is a McBurney point. How we need to measure mean, this is the umbilicus area and this is the right side of the patient. So what they given, that is that line will be drawn from the umbilicus to right anterior superior iliac spine. So this is the iliac spine area. So from the umbilicus to the right anterior superior iliac spine will have the straight line and will have the 1/3 of the distance lateral line. So this is the 1/3. So this area will use to make the point. So that is called as McBurney point. So this assessment when they'll do mean in case of appendicitis patient. And thanks for joining with me for the today's discussion, and stay connected. You will get more videos related with the nursing officer examination preparation, even with that solved question paper and image based questions. Thanks once again.
If the video is informative, subscribe my channel and like and share the video. You can write your comments too.